So to give a summary about the changing landscapes of EGFR mutant positive non-small cell, I think this is a really exciting time. We're seeing really clear advances, and the survival of these patients has gone from less than a year, not very long ago, to now more than 3 years, heading towards 4 years, with a lot of patients having much more durable benefit than that. And the way to think about the landscape now, these are for typical EGFR mutations, the exon 19 deletion or the L858R. In the first line setting, we now have third generation inhibitors like osimertinib that are clearly better than the first and second generation inhibitors. But we also have the option of adding a drug like ramucirumab, assuming this regimen is FDA approved from the Relay study, to a first generation inhibitor, and then using the third generation inhibitor later in the treatment paradigm. So I think this is two ways the landscape is shifting, either starting with the third generation inhibitor or starting with a first or second generation inhibitor with the addition of a VEGF pathway inhibitor like ramucirumab there. Now, what about at the time of resistance? Well, we're developing more and more tools to tackle resistance. Right now, if there's a T790M mutation as the mechanism of resistance, we can switch to osimertinib. There are a lot of clinical studies underway to look at targeting, for example, MET amplification as a resistance mechanism. There are some other atypical mutations that can emerge as resistance mechanisms to EGFR, like C797S, or mutations at 718 in EGFR or 792, where we may have EGFR inhibitors in the near future that are effective. So I think what's going to be developing over the next few years is more and more treatment options for smaller subgroups of resistant EGFR mutant disease. And then after that, we still have chemotherapy and we still have immunotherapy. Immunotherapy is not particularly effective for patients with EGFR mutant disease, but occasionally it can provide benefit. And I think our group and many others are working on ways to activate the immune system to get immunotherapy to work better for these patients. So I think over the next few years, you're going to see better regimens for targeting resistance to EGFR inhibitor disease and more ways to activate the immune system for this group of patients.